It's National Public Health Week, April 7th to 13th, so what better time to talk about the healthcare industry here in the US? And Sarah Worthy, CEO of DoorSpace, gives us her frank opinions about where it's going and why we need to stop it. Plus, we take a look at other stories making the headlines from around the region. This is Connecticut East This Week. Hello, I'm Brian Scott Smith. Mention healthcare to anybody these days and they'll have a story or several to tell you about either the care they did or didn't get while in hospital, or the fact their health claim was denied, or the fact their health insurance just went up by 100%. The reality, sadly, is all of these things are true, and it's not getting any better or any cheaper when it comes to our healthcare industry. So what can be done? April 7th to 13th is National Public Health Week, now celebrating its 30th year, and created to help advance health equity, improve community well-being, and champion policies that protect and promote public health. I caught up with Sarah Worthy, CEO of a software development company called DoorSpace that primarily works in the healthcare space, and had a frank discussion with her about what's gone wrong with the healthcare industry in this country and that it wasn't always like this. Sarah, thanks for the interview. As a CEO of a company that deals very much with the healthcare space, you have a lot of insight into it. And we all know through various media reports that healthcare is expensive and is going through some issues here in the United States. One of the things, of course, is the constant rise in costs. It doesn't seem to matter where you live in the US, healthcare is expensive. And in some states, it's more expensive again still. Talk to us about your thoughts, because you said in a release that obviously was sent to us that Americans need to have a better healthcare situation in the country, and there should be bipartisan legislation to limit what for-profit companies can do in healthcare. Explain to us what you mean by that.
Absolutely. So when you look at our stock market, usually in the top 10 of the best performing stocks on the market, they're health insurance companies. And meanwhile, the average American can't afford a surprise $500 bill without entering financial problems. And I look at this disparity, and we've had several recent stories in the past few months around the claims denials, the way insurance companies are nitpicking at what is and isn't allowed, the way the payer network directories of the physicians that they have are often incomplete or out of date, so that when somebody decides to go with a certain insurance company and starts paying those premiums, thinking there's a doctor in their network they need, and then not being able to find that specialist in that network that's covered. There's just so many different problems out there. And to me, we're seeing that the market isn't being served. Patients aren't getting the coverage they need, and their insurance costs are rising for what they're spending. And meanwhile, these insurance companies are making record profits. So there's clearly a disconnect there in how it's working. Companies are there to serve their customers' needs and to serve their community needs, particularly in healthcare, first and foremost. And it really does look like today these for-profit healthcare companies, and primarily we're talking about health insurance in this context, but we see the same thing in pharmaceuticals and medical devices and so forth as well, where they're just putting shareholders and their company's growth ahead of delivering on their promises to their customers.
So what sort of legislation do you feel is possible then, or is what you've been thinking about that could help out the situation here? Because if we just slightly step sideways, but still in the healthcare arena, we've got a situation here which is unique to the US of pharmacy benefit managers and the power that they have over a period of time grown in that space, and how they now dominate it and in a way almost dictate to governments, to pharmaceutical companies, the way that they run their business, etc. Where do you see this legislation actually helping, and what should it be?
Yeah, well, far be it for me to say that my ideas are the final solution. However, I think a lot of the suggestions that I've put forth and will share are are worth giving a try. I just think it's important. One, it's not like human society has always had health insurance. That's a relatively novel invention that's maybe 100 years old or so. And we haven't had for-profit health insurance since, yeah, I guess, the 1973 Act in the US was when we finally started to allow HMOs to go for profit. Blue Cross Blue Shield didn't go for profit until 1990. So I think the first step in getting this changed is to just bring that awareness back to everyone. For most Americans today who are dealing with health insurance and both on the cost side or they have health issues that they're trying to deal with and looking at this issue, I want them all to just take a step back and realize 1990, that wasn't that long ago. And so we've had over a 20 or 30-year period from the 70s to the 90s a series of acts that were put in place that allowed these companies to convert from nonprofit to for-profit status. And we've seen correlating directly along that the increase in companies that are abusing what they're doing by denying claims, by looking at profits, by acquiring private medical practices and locking physicians under non-competes, the PBM rise, all of this. So I think the first step is for us all to see this really hasn't been that long. And yes, 30, 40, 50 years, that is a long time. But when you look at the grand scheme of how long this has been part of our society, it's a blip in human evolution. And I think we just need to accept, look, we thought that was a good idea. We have 40 years of data now. That was a terrible idea. Let's undo it. Because that's really the hardest part. The hardest part is getting Americans educated on where the history of nonprofits to for-profit in healthcare came from and letting them see it really isn't that long. I think right now there's a lot of confusion out there. If it's either for profit or single payer. And I don't think it needs to be that. There's always a third option, is just a rule of thumb we have in my world of innovation. There's always a third option. You just haven't found it yet. And I think one of those possible third options is let's keep them, the insurance companies, and not move to a single payer, but force them to go back to being and operating like nonprofits. Companies can convert back and forth. There is a process, but it can be done. And when those insurance companies are now forced to go to back to nonprofit and operate as nonprofits where they're putting the mission first, it will limit what they're able to do. They will be upset about that at the top, but that's a good compromise, right? Everyone's a little unhappy.
I hear the argument, and certainly I think the whole healthcare situation here in the US, it certainly does need more of an educational sort of angle to it because I think too many people are or are not aware of how things work. The problems that we have, though, and again, I go back to the PBM situation, is we've now got a new administration. We don't know what they're going to do. The previous administration, which was Democrat, didn't deal with the PBM situation. They seem to be very powerful and their lobbyists are very powerful. Is it really realistic to think that we're going to be able to get any form of legislation through because of the amount of money that these people wield and basically can effectively buy votes to make sure that the status quo remains exactly that?
So I think it is not only realistic, it is the only conclusion that will ultimately happen. And I think what we need to be looking at this is it's not a will it happen, but it's a how long are we willing to sit around and let this problem grow until we finally do something about it? Because we will have to do something about it. It's progressively getting worse. And we're seeing through these different incidents lately, we had the tragedy of the UHC CEO being shot. At the same time, we saw, I believe it was Aetna in the news for wanting to time cap anesthesia during surgeries, the Medicare Advantage rollbacks, and the fact that right now practices and hospitals are just flat out refusing to accept these programs. For those who aren't familiar, Medicare Advantage is not Medicare. It's not part of the federally funded program. It is a component that the federal government has effectively outsourced to these for-profit companies, and they're operating them differently from Medicare. And they've proven to be very disastrous for the patients who enrolled in those Advantage plans, as well as financially unviable for the hospitals and the clinicians treating them. I think that it's absolutely possible it's going to happen. And now, whether or not we get it done with this administration right now is just a little unique. I think, again, I'm nonpartisan. I look at the way things are in the candidates, but I have personally made phone calls. I've gone out and visited my state senators, my federal senators and Congress people. They will take our calls. They read our letters. They listen to us. They're also listening to unions right now. You talked about the last administration and in some of the fights they did. This is a little bit outside of healthcare, but we had a lot of big union strikes in the last 4 years, and the unions were winning. In healthcare right now, we have seen over the last 4 years an unprecedented growth in physician and nurse union participation. 5 years ago, even, it was unheard of for physicians to be joining unions. And now they're scrambling to get into unions as quickly as possible because the only way we can fight those lobbyists with their giant wallets is through our numbers. And so American people need to not lose hope because what they want, these big corporate lobbyists, what the insurance industry, wealth holders right now want, is for us to believe there is nothing we can do. Because if we think there's nothing we can do, we will accept the status quo. And we have to resist their propaganda because things do change. They do work. And I think that social media is the worst place to get your news to look for this because it tends to promote the dystopian, negative, hopeless content to the top of our feeds and hide the actionable. But I spent a lot of time out there looking and reading and seeing the data, talking to these doctors and nurses and the executives in the hospitals themselves, and what they are all working to do together is to activate within their communities right now and to educate and inform them on what's going on, to unionize and to fight back against this for-profit greed that's coming into their organizations.
What else have you heard from people that you've spoken to? You've said that obviously you've approached your own sort of senators and lawmakers, and they do listen. They don't always act, of course. What are you hearing from, sort of like maybe talking to your customers or even members of your own family about these thoughts? Because you said at the top of this before we started recording that you're not a controversial person. That suggestion of actually stripping healthcare companies back to non-profit status, I would suggest is actually quite controversial.
Oh, I don't feel like I'm controversial in the sense that the average American will disagree with me. Certainly, the oligarchy doesn't much agree with my theories, but I think that's the important thing to remember. Anyway, back to your question. So first, my family, I don't, I don't talk about any of this with my family at this point. After a couple of years, they get tired and tune that out. But my customers, this is all they talk about right now. Our customers at DoorSpace are the hospitals, they're the staffing companies, the physician groups, they're the physicians and nurses that are out there providing care, performing the surgery, they're the pharmacists, and they have a lot of feelings. What a lot of Americans are unaware of is there is a dark side to the for-profit insurance market that looks a lot like what the patients deal with, the claim denials and the hurdles and so forth, where, for a doctor or nurse to get enrolled in this network, it can take 3, 6, 9 months, sometimes longer for everyone. A hospital has to enroll every one of their physicians into every one of these networks, going through this lengthy process. Each has their own stack of paperwork, and it wastes millions of dollars across each hospital. It can waste hundreds of hours of valuable time for physicians and nurses to go through. And they're often still kept in the lurch. They're constantly being denied access to network and told that they didn't finalize something and they missed an email right at a renewal date last minute. The payers do everything they can to make it difficult on both the patient and the provider side. And so they're fed up. There's an understandable amount of resentment when you talk to people who work in healthcare. And we saw that come to light in the recent news where doctors and nurses were in some places actually celebrating a tragic shooting. And so I think it's important to really look at how this impacts the healthcare workforce, not just the way patient care is happening.
What do you want people to do? Because this is a sort of a call to action, isn't it, at the end of the day? So, what would you say to somebody listening to this interview? Member of the public, they might be in the medical field themselves, or they may not, and they may just be the average Joe. What is it that you want them to do?
If they're in the medical field, absolutely they should join a union if they haven't already, and they should help bring others into it because the power of the unions is the only real power they have to fight some of these issues at a legislative level. For American voters, you do need to realize in your state, particularly the states that have leadership right now that is a little bit more on plan, less chaos. I don't know. You can have a huge impact because state laws do often take precedent over federal laws in some of these ways. And there are things that you can get enacted with your politicians by having conversations, but you do need to call, you need to tell them, and you should work within your community. And if this is important to you as a listener, to make happen, then go out and canvass, get your neighbors, get them involved, have a block party and have everybody write letters and send emails. There's templates online. There's a lot of resources out there that Google, with no AI involved, can quickly bring to our fingertips that I use personally, because we do need to care about this. And we really need to care because even if you don't work in healthcare, if you don't have an insurance problem, you are probably like I would say 95, 99% of Americans, where your wages are stagnating and you're seeing maybe even with a big raise, a smaller paycheck than you think you should, and your health insurance claims are going up. And that's because employers are having to pay a huge increase year after year. Your employer has to pay that insurance company even more for those premiums to cover you. And they take that money directly out of your pay. So we need to do something to rein this in. And again, my suggestion of having convert is one that, but we can have legislation just limits the amount of profit. Like nonprofits still make at least as much money as their costs. I think Americans really need to remind themselves that we're not talking about covering your expenses, which includes the salaries and the electricity and running water and so forth to a hospital facility. They're making gross amounts of profit over and above that. I think United Healthcare is making somewhere over 10 billion a year in just profit. And so we need to be aware and tackling that. But caring about this issue and getting out and talking to others and particularly your legislation, but talking to others and getting them involved is how we're going to do this. It's going to take our local communities working together and pushing this up to our state and to our federal layers of policy. The top layer right now is busy with other things and it takes time. So we need to start at the ground and move up.
And now would be the right time to do it with obviously the legislative sessions active in the various states. It's a good time to remind, obviously, your state legislators to tell them what are the things that actually do concern you. And as you said, healthcare certainly is a very big one of them. Sarah, it's been great talking to you. Thank you for your insights and your thoughts, obviously, on the healthcare industry, obviously, as somebody who deals with it on a daily basis, as a CEO of a company that works in that space. And we'll see what happens. But in the meantime, Sarah Worthy, CEO of DoorSpace Inc., it was great talking to you.
Thank you so much for helping us get everyone activated on this issue, Brian.
I'm the threat that's already inside the house. I can't be scared away or negotiated with. You can't call the cops on me. You can't even see me. I'm the threat of family fire, And as long as your guns aren't stored securely, I'll be there. Protect your family. Learn how to make your home safer at endfamilyfire.org. Brought to you by Brady and the Ad Council.
Time now for a look at other stories making the headlines this week. Connecticut College marked 40 years of disability advocacy recently with the opening of their Disability Cultural Centre. The event is to celebrate and highlight the progress the school has made since the movement's inception in 1984 by disabled student John Sharon. Sharon returned to the college as keynote speaker for the event and recalled his time at the school and what motivated him to advocate for change.
Why isn't there an elevator going down to the squash courts below the new gym they were building at the time? The answer I got from the architect was, well, why would somebody in a wheelchair want to go down to the squash courts? And I said, to play squash. And he had never thought of that before. Started asking questions about lack of accessible parking, lack of accessible entranceways to buildings, and just so many stairs. And that's really what started it.
Sharon says despite changes in the law and the American with Disabilities Act, much more still needs to be done for those with disabilities.
People with disabilities are still living on the margins. They're still having to struggle to be accepted, even though we have laws in place now that get people into the buildings and can allow for people to get access to programs and services and whatever. But the mind shift hasn't happened the way that people thought it would, I think.
The new centre will showcase artwork created by artists with disabilities and feature students utilising the space. It will also showcase the school's recent facility improvements as well as disability-related academic offerings such as disability in the media. According to data from the CDC, more than 1 in 4 or 70 million adults in the United States report having some form of disability. A new study from Yale School of Medicine is shining a light on how healthcare company payouts favour shareholders and are increasing the cost of healthcare for every American. Carrie Gross is one of the study's 2 authors and is a professor of medicine and public health at Yale School of Medicine. Gross says they looked at 92 large healthcare companies for their study and were surprised at the level of shareholder payout by them.
19 companies accounted for 80% of all of the shareholder payouts. So some of the largest were, for instance, within the pharma world. Pfizer directed $360 billion in shareholder payouts back to their shareholders. United Healthcare, over $100 billion. Hospital Corporation of America, $89 billion. Each of those was greater than the annual NIH budget.
Gross says it's not just the for-profit healthcare sector that's returning huge profits. The non-profit side is as well.
You know, the number one cause of debt in our country is healthcare debt. By some studies, the number one cause of bankruptcy is because of medical bills. Things have gotten completely out of control. It's fair to say that the non-for-profit sector within the healthcare system also bears some of the blame. Some of these large academic centers are also become local conglomerates, which can drive up costs, decrease competition, but nothing compared to the large national conglomerates. And we're talking about hundreds of billions of dollars in revenue.
Gross says of the $5 trillion spent by the United States on healthcare in 2023, 70% was funded in some form by taxpayer money to healthcare companies, including tax breaks for employer-based health insurance, as well as direct funding via Medicare and Medicaid. He says over the past 20 years, shareholder payments have tripled over this period, but the same level of money has not been reinvested into the healthcare system by for-profit companies. US Congressman Joe Courtney joined Habitat for Humanity of Eastern Connecticut recently to break ground on their latest housing development in the city of Norwich. Courtney has been instrumental in helping to boost housing supply in the state and reduce the cost of homes. Courtney said owning an affordable home can be difficult, especially if you're on a lower income.
Habitat has always done give people not only a place to live, but also the empowerment of being the owners. The place they live just has so many ripple effects for families, but the community as well. I just cannot say enough about how much I admire the people at Habitat who do this really on a shoestring budget as far as making sure that every input cost is done at the safest, highest quality, but also lowest cost.
2 new houses are being built with ARPA money given to Habitat by the city of Norwich on a site that has been unused for 40 years. Sarah Luffler is the executive director of Habitat of Eastern Connecticut and explained how much they've achieved and how many people they've helped in their short history.
Since 1987, Habitat for Humanity of Eastern Connecticut has built or remodeled 111 homes. We are very proud of the work that we do, And we have served more than 120 households. Some folks have moved on from their homes and new families have moved into them. And we have 6 homes available for our application right now. These 2 are 2 of them. And we are sorting through probably over 50 pre-screen applications right now and 16 actual homeownership applications. Our program is growing.
The 2 new houses will be ready in about a year and will be sold to homeowners earning between $53,000 to $85,000 annually. The University of Connecticut and the University of Rhode Island have been jointly awarded a 5-year contract to help with workforce development for the maritime industrial base in the region. The contract was awarded by General Dynamics Electric Boat and is funded by the Office of Naval Research to help build the nation's submarine fleet. Lexi Hain is the director of Yukon URI's Navy STEM Coalition and explained more about the program.
A real focus is on some of our K-12 programming. We work with students, and our goal is to be able to bring content into the classroom at no additional cost to the teachers. So we go in with our team and a team of undergraduate students as well, making sure that we can inspire this younger generation of engineers. And we're talking about scaling our throughput over 5 times what we're doing right now, working with over 5,000 students per year.
The coalition started back in 2017, but in the last 3 years have increased their presence across southern New England, engaging over 13,000 students in the fundamentals of naval science and engineering. Haynes said they're reaching out beyond just the 2 states to the rest of the Northeast as well.
Right now, we can go anywhere where they'd like us within reason. So we're going to a couple events in Maine near where we have Bath Ironworks, and we have some summer programs for undergraduate students that are really from the national perspective. Our goal is to attract the top talent from anywhere in the U.S. to then come to our universities, hopefully get really excited about the research that we're doing and consider graduate school opportunities here as well, and then hopefully feed into our workforce.
The coalition is also offering funding for those already working within the industrial base to come back to either university for graduate school to increase their skill set. According to the United States Navy, the maritime industry will need over 150,000 new employees in the next decade to meet procurement demands, including the submarine sector. And Connecticut's culinary scene will be represented again this year in the 2025 Restaurant and Chef Awards nominees announced by the James Beard Foundation. 2025 is an important milestone for the James Beard Foundation. It's their 35th anniversary of the awards, considered to be among the nation's most prestigious honors. Awards will be presented in 25 categories this year with an expanded focus on cocktail and beverage service. Connecticut's nominee this year is Brian Lewis of the Cottage in Westport. Lewis also owns Full House Hospitality Group and got his bachelor's degree in food service management from Johnson & Wales University. The James Beard Awards, first presented in 1991, recognise exceptional talent in the culinary and food media industries and are often referred to as the Oscars of the food industry. They recognise a range of experiences from fine dining restaurants to casual gems in 22 categories. Winners will be announced on June 16th, and last year, executive chef of the Shipwright's Daughter and Mystic, David Standridge, won Best Chef of the Northeast. That's all from us for this edition. Do send us your questions and story ideas to the show via our website at connecticut-east.com or Facebook or Twitter at Connecticut East and on Instagram at Connecticut East This Week. And you can listen to the show again on our social platforms on demand and by asking your smart speaker to play Connecticut East This Week podcast. And please like, follow and share on your social media too. I'm Brian Scott Smith. Thank you for listening.